am Quality Management Coordinator over at LifeWorks. My background is also in working with trans populations in outpatient mental health settings and the larger LGBTQ community as well. I had the really fortune of interning and then working at Fenway Health in Boston, which is a community health center, medical home, largely geared towards the LGBTQ community, and that's where I kind of got into this passion area of mine, and I come at it from a variety of lived and professional experience, so I tend to weave a little self-disclosure into my presentations here, make it a little bit more real. I am from the East Coast, so I speak a little rapidly if I'm going too fast or if I'm 10 steps ahead of you with the terms that I'm using. I know this is a big group, but feel free to raise your hand and ask a question as we go along. There'll also be some time for questions at the end. So 50 minutes, it's going to be kind of a real quick surface level drive-by training here, but Dr. Mulder-Ross is going to do some additional training for providers, and I'm happy to come and assist front desk admin staff to talk about any special issues or concerns that you have coming up around this and customer service and things like that. So it's not designed to be a one and done thing by any means, but I do appreciate you all being here and being willing to serve these folks and these communities, because it's really amazing work. So go ahead and jump in. It would help if I turn my clicker on. So, or if it won't work at all, there we go. Our agenda today, we'll talk a little bit about background, go through some basic terminology. I want to pay particular attention to folks who identify as non-binary or genderqueer or gender fluid, and we'll talk about that. We'll take a look at some implications. So what does it mean to live in a world that maybe isn't so ready for you to exist in it, and the different risk areas that exist, both with comorbid behavioral health and physical health things that go on, as well as general statistics. We'll talk a little bit about microaggressions and implicit bias. So these are the things that happen in day-to-day life that really work to wear people down, even if the intentions are the best of the person communicating these things. And then we'll go through quick do's and don'ts on how to be an ally and some practice recommendations before question time. Sound good? Yes. All right. So background, as awareness is increasing about lesbian, gay, bisexual, and queer folks, and most recently transgender folks, people are becoming more visible. They're more likely to say, hey, I'm here and I want to be counted. And they're more likely to try to access care from supportive and open and affirming providers, especially if they identify as transgender and are looking to undergo a medical transition. So that means taking hormones, accessing surgery, etc. And what that means is, as these folks are coming out and declaring themselves and saying, you know, I need my identity and my needs to be recognized, is that it's bumping into society who maybe has been the ostrich under the sand, not acknowledging that trans people have existed for many generations. Maybe it's bumping up into people who have some level of awareness but are kind of stepping in the mud with language and things like that. So these trainings are designed to raise that awareness and then dig a little bit deeper based on practice recommendations and some low-hanging fruit that you can pretty immediately change and have a pretty big impact. So you probably all know each other, but bear with me and do this little thing for me, because it is pretty important to get in the mindset of a client or a patient who might identify as transgender or as lesbian, gay, bisexual, or queer. So in little groups of 3 or 2, just turn to each other and introduce yourself using 3 statements. But before you do that, I want you to think about the 3 most important pieces of your life or your identity, and you cannot use any of those 3 things to introduce yourself. So take about 5 minutes to do that. Huh? You can't do it? All right. Well, work with it.
I thought we were going to get to say it.
I know. I'm like, yeah.
I got it.
I'm a mom.
Right? I'm a mom
Yeah.
and a nurse. I'm a wife.
Right.
out of it.
What was that like for folks? Difficult, hard? You said I can't do it initially. I want you to hold on to that, because as folks are entering this clinic, they might not know if things are going to be okay for them to say, I'm gay, I'm trans. And the acrobatics and the energy that goes into navigating life with a marginalized identity, whether it's racial, gender, sexual orientation, is energy that's taken away from other pursuits. So when we take a look at the statistics regarding unemployment and discrimination, you can imagine that if you're having to go through these everyday acrobatics, it really takes a toll on your well-being and your ability to kind of function in the world. So just hold on to that as someone is coming in, and maybe you're tripping over language, and that's okay, as long as you're apologizing and trying to do it differently the next time. But little steps that you can take to say, I'm trying here, this is something I really care about, I want to be an open and affirming provider, can really help minimize the amount of energy that it takes for that person to navigate a medical or mental health setting. And that means that they can kind of catapult themselves further on their journey to living a more authentic life. So, thanks for playing. So what I'll tell you about language is that it is constantly evolving. I volunteer at an organization that serves LGBTQ youth in Clackamas County, and they have a drop-in every Wednesday night. And I tell you, I leave there every Wednesday that I volunteer with a new term that I never knew of. The kids these days are just, revolutionizing language. But there are some basics that are understood to be pretty common knowledge at this point in time, and I just want to touch on them really quickly with the kind of disclaimer that identities are always individualized, so please make sure to ask folks, if appropriate, to define it for themselves. So we've got sexual identity on one side and gender identity on the other side. Sexual identity refers to who you are attracted to. And gender identity is how you see yourself and how the world reflects that identity back to you. Everyone has a sexual identity, everyone has a gender identity. Privilege means that you've never had to think about it before. Having some sort of marginalized sexual or gender identity means that you probably think about it every minute of every day. Gender identity certainly informs sexual identity, but they are typically mutually exclusive categories. So on the sexual identity side of things, we have lesbian, gay, bisexual, and queer as the most commonly used terms. You may hear folks refer to themselves as asexual or pansexual. Asexual means not attracted to anyone. Pansexual means attracted to all genders. So that is considered to be a more expansive term than bisexual, because bisexual implies that there's still only two choices, male or female. So this idea of two choices, male or female, is what we refer to as the gender binary. And it's really what underpins transphobia and homophobia, because there's a narrative assigned to the gender binary. So you're born a boy, you're assigned a boy at birth, you're assigned a girl at birth. Boys grow up to be masculine men attracted to feminine women. Girls grow up to be feminine women attracted to masculine men. And anytime you step over one of those lines, there's some sort of correction from society, whether it's a sideways look, verbal harassment, all the way up through violence. Does that all make sense? Okay. Queer is, it can be a bit of a hot button term for folks, depending on your culture, generation, etc. It has been reclaimed by many members of the community to imply a sexual identity that says, you know what, I don't fit into these boxes, I'm attracted to all genders, or I'm trans myself, so there can't be a same or opposite sex for me to be attracted to. And it can be an umbrella term as well. So you might hear someone say, I'm part of the queer community. The thing particularly about the word queer is that we should avoid using it unless someone has identified themselves as such. Does that make sense?
So it can still be interpreted as offensive language?
Yes. Okay. So, if someone said to me, oh, you're so queer, it would be meant as an insult, depending on who it came from. If it was from one of my friends, I'd be like, oh, hey, girlfriend, yeah, you know. But yeah, you wouldn't want to label someone as such unless they claim it for themselves. So thinking about, you know, maybe an intake appointment where you would discuss a presenting problem. If I came in and I said, okay, you know, I'm a 30-year-old gender queer identified person, you might put that in the opening line, but only because I've assigned it to myself. Yeah. On the gender identity side of things, transgender is probably the term that you've heard most often. It is becoming an umbrella term for anyone who has moved away from their assigned gender at birth. So when a baby's born, what's the first question? Is it a boy or a girl? Right. So there's that gender binary thing again, right? Anyone who is moving away from that idea of the medical establishment or parents saying, yes, this is my boy child or my girl child, and either changing from girl to boy or boy to girl or existing somewhere in the middle, that is transgender. It's also shortened to trans sometimes as an umbrella term. And it encompasses people who identify as genderqueer, non-binary, gender fluid. So genderqueer means that someone doesn't identify with the binary. So the choices of male and female do not fit. And they consider themselves to be between, beyond, or outside of the choices of male or female. I identify as genderqueer, and I say, you know, I experience some dysphoria around my body, but for the most part, I'm pretty comfortable with who I am. And I just don't feel like I fit into society's categorizations of myself right now. If the concept of woman was expanded someday to include people like me, then maybe I'd be more comfortable identifying as female. I was certainly socialized as female, but I feel more comfortable in kind of a masculine presentation. But that's my interpretation of genderqueer. If you have a patient that uses that term, you're going to want to tease it out and ask them to clarify what that means. Is that clear? Non-binary is a similar thing, not identifying with the binary. Gender fluid means someone who may fluctuate between different presentations and different identities, and it's not an experiment. They truly feel like there are two genders in their bodies, and one day you might see them in a skirt, and the next day you might see them in a shirt and tie, and that's just kind of how they roll. So everything is valid. Just ask people to define things for themselves. Any questions on that? So I think that this presentation will get sent out to you. This genderbread person is a helpful tool to drive these points home. So attraction, who we're attracted to, biological sex or assigned gender at birth is essentially what's between our legs. Gender identity is in our minds, how we perceive ourselves to be, and then expression is how we communicate our identity to the world. So if you have some time, maybe you're having trouble sleeping at night or whatever, feel free to go through this exercise and see where you land on these continuums for each of the categories. You can have both a masculinity and a femininity in your gender expression. I just came from another similar training, and there was a person there who, 6'5", full beard, pretty muscular, and he says, well, I got really hung up on that gender expression question because I feel like I'm very masculine, but I cook at home, I do laundry at home, and I feel like people would call me feminine because of that. And I was like, well, that's a different conversation about how we assign stuff, right? But he was able to locate himself pretty far to the right of the masculine continuum here, and then slightly onto the feminine continuum. And he was kind of shocked by that. He was like, oh, so even though I'm a man, I'm very masculine, people see me as a man, there are still pieces of myself that society or myself would label as feminine. Does that make sense? Okay. Few notes about trans folks. Not all trans people access medical care. Oftentimes it's because they choose not to. It's not how they see themselves in the world. They may take other steps to modify their expression so that other people read them as they wish to be read. And you've probably heard a lot about this here, the largest reason that people don't access medical care is because of access issues and issues of discrimination in care. When we look at the statistics, I think you might be shocked to see the amount of respondents to this one survey who have said that they've experienced verbal harassment and physical assault in medical care settings, as well as the number of people who have been denied care altogether because they are trans or gender nonconforming, genderqueer. Some folks choose to socially transition, so changing their pronouns, changing their name. If they live in a state that allows them to change a gender marker without having to access medical care, they might do that, but they may never go on hormones or access surgery. And this slide is up here to really communicate that no one person's journey through a transition is the same. And I think what we commonly hear in the media is what I like to call the born in the wrong body story, where someone says, I was born female, I was assigned female. As soon as I could talk, I said I was a boy. I've always felt like a boy. I'm now in my teenage years, going through female puberty. I have lots of pain, lots of dysphoria. I want to make some changes so that I can affirm myself as a male. And that's certainly many people's stories, but it doesn't always follow that pattern. Some people don't have the opportunity to even think about it until they're out of their parents' house, for instance. Or someone who might be 40, 50, 60 years old didn't think they could ever access medical care, or maybe they got married young and they can't think about disrupting a family. So they've had this kind of in the back of their mind, but they haven't really questioned it or thought about it. So when I've worked with folks who have that story, a lot of the work that I've done is around the shame and guilt they feel about not being open and disclosing their identity sooner in life. So just something to keep in mind. A specific shout out to my front desk staff over here. You all are often the folks that are the first point of contact when people come in. So you really have the opportunity to set the tone and to communicate to the providers about what someone needs, what their pronouns are, things like that. So if you're able to create that environment that's open and affirming, whether you have a signifier, something on your name badge. I don't have my name badge on, but I wear a rainbow lanyard. Maybe you have something on your little badge or your clipboard that says, hey, I'm a safe person to talk to. I can help you navigate this process. It can really free people up and again, diminish the energy that it takes to go through those linguistic acrobatics. Non-binary, genderqueer identities. So again, these are folks who identify existing outside of, in between, or beyond the gender binary, the choices of male or female, man or woman. They might refer to themselves as non-binary, NB, E-N-B-Y when you spell it out. So the phonetic spelling of the letters N and B for non-binary. Genderqueer, gender fluid, agender, etc. As one of the young people I work with uses gender fabulous, which I really appreciate. And it's often these non-binary genderqueer folks, as well as folks who are kind of in the in-between phases of transition, of medical transition, that are the most targeted for violence. They are the folks who are most identified as other, and the folks that people in society feel like they need to provide some sort of assistance or correction to them so that they align themselves more with a male or female presentation. So just keep that in mind. If folks are coming in who maybe look like me or a little bit more in the middle, androgynous appearing, that they might potentially be more at risk. And so we need to be kind of extra sensitive about how we approach them in public areas and things like that. So some implications. When we're talking about LGBTQ youth, we're seeing that 50% are coping through substance use. 50% have attempted suicide, and they've been labeled with disorders, with diagnoses that will follow them throughout their lives. And what I encourage people who are diagnosing to do is to think about what you might be seeing as a common symptom of a DSM diagnosis, and think about it in the context of trauma and what it means to live in a body that you don't feel comfortable in, and what it means to live in a society that tells you your body's wrong all day long. Yeah, you're going to be anxious, you're going to be depressed. There's been a lot of research recently about overdiagnosis of autism spectrum disorders in trans youth, and they're still trying to piece that out, but what they're seeing is that folks are having to kind of shut down their feelings and their affect, so they look like they have a blunted affect. There's a lot going on underneath the surface, and they're having to adhere to society's rules, and it might come off in a very rigid, stereotypical way, and then they get slapped with an autism diagnosis. So just a little nugget to throw out there. We'll see how that research unravels as the years come down the line, but just something to think about. And then we're seeing further trauma from reparative therapies and rejection from family members, friends, etc. In case you are not aware, the state of Oregon has banned conversion or reparative therapies for LGBTQ youth. It is a reportable offense to Child Protective Services, so keep that on your radar. But I think the two most striking statistics up here are the rate of substance use and the rate of attempted suicide. And this is just one study. There are some questions that this rate of attempted suicide is actually lower than in reality. So it's a pretty big deal. These are young people and young kids. The Injustice at Every Turn report came out in 2011, and it was based on the National Transgender Discrimination Survey. It was the first of its kind to comprehensively count trans people's experiences as separate from lesbian, gay, bisexual, and queer people's experiences. And what they found, particularly as we talk about healthcare settings, is that 50% of the respondents reported having to teach their medical and mental health providers about their identities. They became like the token expert, and rather than receiving care, had to bring in articles and books about trans experiences in order to get the medicine and the care that they need, whether it was trans-related healthcare or other healthcare. So this is a great start of reducing this number. Hopefully after today, you won't have patients having to educate you, so that's awesome. 11% of people reported mistreatment in mental health settings. So that's from being misgendered, so people using the wrong name or the wrong pronoun when referring to a client, or being denied care altogether, saying, oh, we don't serve people like you here. That has been said. 41% of the respondents to this survey had attempted suicide, and that's compared to 1.6% of the general population. The numbers go up when you start laying things like employment or unemployment and race and survivors of sexual assault and physical assault. They go all the way up to 60%. So pretty big deal. The other thing that is not up here on the slide is that 19% of the respondents had been denied care in medical settings altogether. So they came through the door, and based on their presentation or their disclosure of a trans identity, the clinic said, we can't serve you here. Other things that we see happen in medical settings, and full disclosure, this happened to me about 2 months ago. I went in with a really bad cold, and the medical assistant was very well-meaning, but saw a medication on the list that maybe informed her that I was somewhere in the trans umbrella, and she said, oh, are you changing? And I was like, what? Am I changing what? And she goes, oh, like changing, like you were one way and now you're another. And I was like, well, I mean, I don't really want to get into this. I think I have a sinus infection and I want to talk about that. And she was like, no, I know. We got this training, and I have a neighbor that's trans and blah, 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 blah. So now I'm in this position where this person has clearly tried to make a connection with me, but has done so in a way that really puts me on edge and really has nothing to do with the reason why I came into this clinic to get care. So That's kind of a minor example. There are lots of other examples of folks who go to the emergency room because they're feeling suicidal, and someone draws that very soundproof curtain around them, and the doctors and the nurses and the techs are all outside saying, "Oh, did you see this person's trans? I wonder what's between their legs," or "Do you think they've had the surgery?" And kind of the gossip mill gets going. So if you can imagine someone who's suicidal being in that environment is not going to help things. So I don't think that's going on here, but this is the stuff that people are carrying with them as they're entering the door, and that's why they might be a little bit distrustful of the doctor-patient relationship or interacting with front desk folks, etc. This is a breakdown by race, so again, just showing once we lay the racial kind of demographics on top of a transgender identity, folks are more at risk. Trans women of color are the most targeted population. They attempt suicide at a higher rate than their white counterparts, and they also are honestly murdered at a higher rate than their white counterparts. So this is real life or death stuff, frankly. Yet we see that 76% of folks who responded to the survey were resilient. They were determined to get the care that they needed, even in situations where they might have been at risk for abuse or having to educate their providers. So people are wanting this. They're willing to jump through hurdles in order to get the care that they need. This is particular to LGBT older adults. You can see the statistics up here, but this one right here is particularly striking. Almost 90% of LGBT older adults felt that staff in medical settings, both live-in and clinic settings like this, would discriminate against them based on their sexual orientation or gender identity. That's 9 out of 10 people. Pretty big deal. So a note on microaggressions. So this is borrowed from race theory, and microaggressions are those everyday slights, language missteps, etc., that communicate a lack of awareness all the way up to outright hostility. Often these statements or actions are well-intentioned, but what it ends up doing is actually creating a disconnect between the person or place that is communicating this information and the person at the receiving end of it. So a great example is gender-neutral bathrooms, right? So it might be something you've thought about here. At the last place I was at this morning, we were talking about gender-neutral bathrooms, and they were like, well, we have some up on the 10th floor that are single stall that we could easily make gender-neutral. Well, the office was down on the 5th floor. So yes, it's a great effort to try to get an all genders or gender-neutral bathroom in place, but what message are you sending when you're saying, you can't use this other bathroom, you have to go all the way up, 5 floors up to the 10th floor? So that's an example of something that's very well intentioned, but serves to create more of a disconnect. Things like using pronouns incorrectly can be a microaggression. Things like pausing if I walk into the women's room and you look at me, you look at the sign, you look back at me, and then you say, excuse me, you're trying to help me out, right? Trying to give me some information that I maybe misread the little stick figure with the dress on the thing. But you're creating that disconnect. There's no opportunity for a relationship there. Does that make sense? Okay. Language is important. Where we have transgender on one side, we have cisgender on the other. And cisgender means that you are someone who identifies with the sex that you were assigned at birth. Who here thinks they're cisgender? Who's not sure? Who's never been asked this question before in your life? Yeah. What I'll tell you is that trans people think about their gender all the time, and being cisgender means that you probably don't have to think about it. And when we're talking about steps that folks take to become more comfortable in their bodies, we're referring to folks as affirmed male and affirmed female. So they're affirming their gender identity. You might also hear these terms, trans man, trans woman, F to M, M to F. Transgender is designed to be used as an adjective, so it's not a noun. You don't refer to someone as a transgender. You might say a transgender person, but you wouldn't say, oh, Jess is a transgender. Not okay. Transgendered makes it a verb, so if you say Jess is transgendered, it means that I'm a verb. I'm not an adjective. It's not describing kind of an element of my personality. Definitely avoid terms that potentially have been reclaimed by communities. I won't say it on camera here, but it starts with a T, and it kind of is the prefix for trans with some extra letters added in there. But it has been reclaimed by communities. You might hear people refer to each other in the community as such, but as a non-trans person, you should not use words that could potentially be insulting. All you need to do is look up RuPaul's Drag Race to find out what term I'm referring to here, but it is very offensive. So, and I'm happy to tell it to you one-on-one if you want to come up afterwards. So raise your hand if you've heard any of these statements. So, yeah, but what's your real name? A little bit, okay. Wow, you passed so well, I would have never guessed you were trans. So it's designed to be a bit of a compliment, right? But if you say something like that, what you're really saying is, thank you, trans person, for taking steps to make it easy for me to figure out what camp you belong in. You don't look like a man, or you don't look like a woman. When did you have the surgery? This is a big one. There's no the surgery. There are several surgeries that trans people have, and not everyone accesses all of them or any at all. Excuse me, this is the men's room or the women's room. It's a big one. Oh, so you're really a girl? No. That's what my birth certificate says, but I identify as this way. Oh, so you're becoming a man? No, no one's becoming anything. They are, and they're affirming that identity. Some people describe being trans as they got stuck with the most unfortunate birth defect ever, and they need to figure out a way to correct that. Not everyone, but some people have described their experience that way. What are you? What is it? That's we're getting a little bit higher on the criticism scale here. This is a big one. Hey ladies, hey guys. I'm from the East Coast, everyone's guys. I've had to really retrain myself to say folks or y'all. Pick up a little southern thing, right? But I've noticed, particularly in this Portland world here, that ladies is used a lot. If there's like at least two people at the table who could be a lady. So think about it in terms of those customer service training things that you might have had. Sometimes creating an open and affirming environment means that we have to retrain our brain a little bit. And we might have had it hammered into our brains that we need to ma'am and sir everyone who comes through the door. But it turns out that that might actually send a message contrary to what you're trying to accomplish here. So just think about that. What's your husband's wife's name? If, depending on who's in front of you, you're making assumptions that either everyone's married or that they should have a husband or a wife based on their presentation. For two female presenting people who have a child, statements like who's the father or who's the real mom, that happens a lot. So just keep these things in mind. If you catch yourself saying these things, or if you feel like you've said this in the past, no blame, no shame. Just think about it and figure out how to get around it the next time. So, how to be an ally. It's part of good customer service. That's my tagline here. We have some do's. So, take people's identity seriously, even though it might not line up with your own ideas of sex and gender. Treat their identities and choices with respect and with the same respect that you'd want for yourself. Ask about preferred names and pronouns, but do so in a way that doesn't out someone. So the example that I give is, if someone walks through the door here and has a beard and you say, "Hi sir, how are you?" And someone else walks through, has long hair and a dress, and you say, "Hi miss, hi ma'am, how are you?" And I walk through the door and you say, "Oh, hi how you doing today? What's your preferred pronoun? It's a public area, so you've potentially put me at risk, and you're still othering me in a way. So rather than making it a common practice to either ask everyone or invite everyone to provide that information, you're singling me out based on my appearance. Does that make sense? So the advice that I give folks, because asking people what their preferred pronouns are can be a little sticky, especially in a public setting, especially because you might not have the bandwidth to educate every single person who comes through the door who's like, preferred pronoun, what? Why are you asking me this? So a good way to do it is either to have on your name badge a little ribbon that says, you know, pronouns, whatever yours are, or if you're a provider and you're meeting someone for the first time, just across the board you say, hi, my name is Jess, I use they, them pronouns, or I use he, him pronouns. And for the people who that will matter to, they'll take that invitation to say what theirs are, or to make some sort of disclosure about their identity. For folks who that makes no sense to, they might ask why you do it, and you can just say, hey, it's common practice across the board. You might go a little bit deeper and say, we are an open and affirming environment for LGBT folks, and that's why we do it. But generally speaking, they'll either say, okay, whatever, he, him, or they'll just move on to why they came in. Does that make sense? Okay. Respect a person's choice of name, gender, pronoun. Make sure you're using it consistently. I know electronic health records can be very tricky, and maybe Dr. Mulder-Ross can talk more about that. I know y'all are in EPIC, so feel free to reach out to OHSU's Trans Health Program. They have EPIC as well, and they've figured out ways to add information to the patient banner up the top. Thank you. So there are options, even though health records can be limiting. Remember, not all trans people are the same, and like everyone else, they have different identities, different sexual orientations, different stories. Act as an ally with others in the community, with kind of this disclaimer that if you have a personal relationship with someone you consider to be an ally of, you want to check with that person to see how they want you to be an ally. So the example that I give is if I'm out to lunch with my friend and server comes over and says, oh, hey, ladies, and she pipes in and she's like, there's no lady here, blah. Might not be what I want that day. Maybe I've had a long day and I just want to eat my hamburger in peace. I know it's not always PC to say I eat meat, but sorry, vegetarians and vegans out there. So we would have a conversation ahead of time, and I would say, you know what, today, if the server comes over and says, hey ladies, I don't care, I just want to put my order in, whatever. Or I might say, today I feel pretty good, I'm going to step up and say something for myself. Or I might say, hey, today it would be really helpful if you would go to bat with me, and just remind her that, or remind the server that not everyone identifies as ladies or gentlemen, and use neutral language. Does that make sense? Okay. Hopefully the handouts got sent out to you. The ally do's and don'ts are included in that. Some don'ts: don't ask about anyone's body, genitals, medical procedures, or medical history unless it's relevant to what you're doing. Most of the time it might be, depending on your role here. Don't unnecessarily refer to a person's previous gender status or previous name. Really try to use their identified name. Don't insist that someone must be either a man or a woman. As we've kind of discussed today, folks exist in between. Don't say things like, but you look like a woman, or, but I've always known you as a man, this is going to be very hard for me. Don't overcompensate if you make a mistake. This is a big one. So we're well-meaning, we feel bad when we hurt people's feelings, but if one of my friends said the wrong pronoun to me and then was like, oh my god, I'm so sorry, I didn't mean to say that, I just went to this training today, it was really awesome, they told me to use the right pronouns and I just feel so bad, I'm such an awful person. Well, now I'm in a position where I have to be like, you know what, it's okay, don't worry about it. But in actuality, I was the person that kind of had something done against me. Does that make sense? Okay. Don't be afraid to say, I don't understand, but I want to be respectful. Or, hey, I'm trying this out, this is a change for me, I really want to respect your identity, but I might make some mistakes. feel free to call me out, and I promise I'll try better next time. So don't be so paralyzed by the idea of making a misstep or accidentally using a wrong pronoun, but acknowledge that it's a growth process for you, and really take efforts to change it on the back end. Know your resources. Expect to meet LGBTQ folks. Educate yourself and be honest with yourself. Figure out where your blind spots are, where you need more training and education. In the clinical environment, make sure forms contain options for various sexual orientation and gender identity disclosures. A blank line is really great. Figuring out how that translates to the EHR gets a little bit more complicated. As I said, use signifiers like posters and stickers or lanyards that communicate that you're a safe person to talk to. Make it a practice to ask or invite everyone so they can provide their preferred pronouns as appropriate. In your documentation, get creative as much as possible so that you can use the identified name whenever possible. If someone has a lesser known pronoun, like the two on the screen here, Z and here, we should definitely be using them, but we might need to do some more identification and definition around them in our records. Practice makes perfect. Again, acknowledge that it's a growth area for you. Be transparent. Honestly, people are more appreciative of the efforts that folks are making, and they're not going to keep a tally of, oh, you did it wrong today, so I'm going to write you off. As long as you're transparent that it's an area of growth for you. When we're thinking about client-centered practice, make sure they're defining meaningful goals as it relates to their transition or other co-occurring health stuff that's going on. Don't assume a client's family or relationship structures. It probably goes without saying, but for many of the patients and clients we work with, the idea of family can be a very triggering term or theme. So I usually ask who's on your care team, who's on your support team, rather than who's your family. And make sure you're aware of those risk factors for LGBTQ populations and are addressing them in care. And Dr. Mulder-Ross will talk more about that. And now, my unicorns. Does anyone have any questions? You all in the after lunch crash? Yes.
Where can we get posters or decals that signify that we honor diversity here, that we could put in the lobby or our exam rooms?
Okay. So the question was, where do we get posters, stickers, all those things to put in lobbies, exam rooms? GLSEN, G-L-S-E-N, it's the gay, lesbian, bisexual, and trans support and education network. They give away kits with stickers and posters and things like that. A lot of the work around safe schools will have those things. If you just Google safe zone poster, you can see images and you can tweak them to figure out what will suit your purposes. So, yes.
How do you feel about forms where it says male, female, other?
Okay, question was, how do I feel about forms that say male, female, other? I do not like them because you have the word other on there and that automatically others someone. So the best thing to do would be to just have gender and then a blank line. That's kind of best practices. But if you have to have check boxes, have a variety of check boxes. So male, female, genderqueer, non-binary, and then if you want an other category, figure out a different way to identify that. Maybe neither male nor female, etc. Good question. Other questions? Yes?
I was just thinking about our AG software, and you have to put in male or female because it identifies, it calculates the person's their lung function depending on it has all the data on their body type, if they're male or female. And I'm trying to think of a nice way to ask somebody, okay, I have to put you in as this or that, and try not to be offending them. So.
Okay, so talking about electronic health records and when we're looking at kind of norms for blood counts and things like that, sorry. And how do we compensate for that when male or female are the only choices? So be transparent. And most people are pretty aware that that's the case, that that's how health looks. And, someone who might be on hormones might tip one day into the male scale or the female scale. But in terms of body norms, if you're transparent and you're saying, like, listen, these are the only two choices that I have to figure out if you're in normal limits or if this is something that we have to be concerned about. However, there are other ways that I can make sure your identity is affirmed in our record system. And actually, OHSU, they have what's called the Transgender Health Questionnaire, and the providers use it, and it's basically a count of what organs the person actually still has, so they only have to answer that question once. And so tests and whatnot can be ordered based on what someone has. And I'll take one more question, and then unfortunately time is up. Did you have a question in the front here? No? Okay. Well, thank you again for having me and for welcoming me on your retirement day and sitting here for an hour. If there's anything that I can ever do, you both have my contact info, and I'm happy to come out and support you in whatever way. It really is amazing work to be done, and I appreciate you all being willing to listen and willing to be champions to provide the best care possible for trans patients. So thank you very much.